So once again, thank you for joining us. Thank you for your interest in NYU Myers. We'll get started in just about a minute to give some join us. Thank you for your interest in our PhD program and learning more about our research collaboratives. We'll just get started in just a moment. Okay, I think we can go ahead and get started. So once again, thank you all for joining us. Thank you for your interest in NYU Myers and our PhD program, and for joining us on the session to learn more about our research collaboratives. My name is Joseph. I am the Assistant Director for Graduate Student Affairs and Admissions here at the college. So it's my pleasure to see you all. And to get started, I'm going to go ahead and introduce Dr. Allison Squires, and she can go ahead with a brief welcome.
Hi, everyone. I'm Allison Squires. I'm a professor here at the NYU Rory Meyers College of Nursing. And our research collaboratives are our way of organizing ourselves into common research interest groups. We started with just one, and it has now evolved into our newest group, which is maternal child health. And this evening, you'll have both a faculty and student representative from each group talking about each research collaborative. So, and when you're a student here with us, you get to join the research collaborative, and this is your way of meeting lots of different scholars from around the university and who are working in your area, and it's a great way to network and make connections too. So with that, Joe, I take it back to you.
All right, thanks for that great introduction, Allison. I'm going to go ahead and introduce Dr. Mimi Niles and Veronica Pasha. So you guys can go ahead and take it away.
Hi, everyone. This is Mimi Niles. Nice to meet you all. I'm here with Veronica Pasha, who's one of our pre-doctoral candidates. Happy to be here and share with you. I don't know if I'd call us a collaborative yet, but we're definitely working towards a critical mass, and I'm very happy for that. So I have some slides I'd like to share, if that's okay, Joseph.
Go right ahead.
Okay, hold on. You would think after all of this, I would know how to do this. One sec. Okay, here we go. So I just thought I would start by just introducing you to the faculty that is part of the burgeoning maternal health research collaborative, me being one of them. And I thought I would just introduce the three of us and our content areas and our areas of expertise and interest. So I'm an assistant professor, and these are my areas of interest, particularly focused on birth equity in public or municipal health settings, both locally, nationally, and globally. I have an MPH, so my drive or my compass is pointed towards the public health direction. And I am a qualitative methodologist with interest in integration of critical social theory, particularly feminist theory, in my research and sort of policymaking that uses feminist theory as well. Next, I want to introduce Dr. Audrey Linden, who is the Ferguson Professor in Health Equity and the Associate Dean of Faculty Affairs. We have similar interests. Dr. Linden is one of my mentors. Maternal health equity, she's very much well known in patient safety and quality in maternity care. Interprofessional communication and teamwork, is also a very strong senior qualitative methodologist and is one of my mentors in that way. And currently we're both working on research on severe maternal morbidity or near-death events that happen in the pregnancy period, and we're using novel methodology that incorporates community-based perspectives and community guiding us in prioritizing the research itself, which is very exciting. And then finally, our newest member is, Dr. Laura Jalife Pulowski, who just joined this September. Very, very excited to have her at NYU. She comes from UCSF. She is a senior scientist and epidemiologist, also focused on maternal health equity. Her work is pervasive on premature birth, gestational age, preeclampsia, complications of pregnancy, and is really doing some innovative work nationally. So really, really excited to have her here. So that's the three of us in terms of who is doing research. We also, just to mention, we have a midwifery program at NYU. So we have colleagues that are, expert clinicians in maternal health care. And, we're in New York City. There are 38 maternity care hospitals. So it really is the city is its own kind of laboratory for maternal health research, I find. And so just if any of you are not New Yorkers, just want to ensure that there will always be a space, and there's a great need for emerging scholars and emerging researchers in maternal health. I want to pass it to somebody I very much like and respect, who is a pre-doctoral candidate, Veronica Pasha. So take it away, Veronica.
Thanks, Dr. Niles. Hi, everyone. My name is Veronica Pasha. I'm now a fourth-year PhD student here at the College of Nursing. I'm a high-risk obstetrics, labor, and delivery nurse by clinical practice, and I do have some experience with quality and patient safety. And so my area of research largely focuses around more systems issues that could impact maternal care. And so I look largely at social determinants of health, or I should say my dissertation is going to look at social determinants of health and pregnancy outcomes. As students, though, we're really empowered to kind of explore whatever it is that you're interested in. Dr. Audrey Linden is my advisor, and so I piggyback off of Dr. Niles. She's an amazing mentor, and a lot of our professors here really allow you that opportunity to kind of just go out there and flourish and see what you would like to investigate. We've had a recent graduate that just graduated fairly recently. She looked at antidepressant use and management during pregnancy. She was a psychiatric mental health nurse practitioner by clinical practice. We had another colleague of ours who just offended over the summer, and she co-created, this was actually really interesting, she co-created a toolkit. She was a visiting home nurse with Family Nurse Partnership, and with her adolescent teen moms was able to come up with this toolkit that looked at sexual and reproductive health and when they would like to have those conversations. But instead of her, she made it with the people that she took care of. And then we have another student who I also admire. I think she's amazing. And she's looking at emotional safety during perinatal care interactions for Black and Latina folks in the United States. So as you can see, you can do a number of different things. You can go and do qualitative studies like Dr. Niles was explaining. I'm doing more quantitative using big data to look at associations between factors. You can really do a lot of things here. And so if any of you are interested in maternity research, definitely feel free to reach out. I guess I send this back to Joseph.
Oh, thank you, Veronica, for that great insight. And for the next group, I'm going to go ahead and welcome the AARC faculty, and that would be Dr. Brody and student Moroni.
Oh, hi, everyone. Thanks so much for being here with us tonight. Moroni and I are going to share a little bit about the Adult and Aging Research Collaborative. They're going to do the majority, so you can see from a student's perspective what this looks like. I'm just going to share a little bit of the overarching kind of overview of what the Adult and Aging Research Collaborative focuses on. Moroni, I don't know if you want to share the slides since you're going to be doing the vast majority of them. But our goal is really across adult and aging research. And so we really seek to build individual programs that are built around the strengths that we have here at Myers and across the NYU campus. So a lot of our work is highly interdisciplinary. And that work is built around both research as well as shaping practice, education, and policy. So, for instance, we engage the clinical leadership within the NYU health system as well as other health systems around the city. So, for instance, I serve on the board of directors of MJHS Health, which has an insurance arm, a home care and hospice agency, and several nursing homes. Dr. Satarangani also serves on the board of that organization, and several of our other faculty serve on several of the other care delivery organizations within New York City. From a policy perspective, for instance, we work with our students as well as faculty in publishing articles within McKnight's, which is the trade organization's um, main outlet in both nursing homes, home-based care, hospice care. And so we have editorials that our students and faculty work on throughout the year in that area. And then we really both support individual professional career development, and each of our students has a individualized development plan that we help to work them through, as well as to create a network for collaboration that's both within the college, so our students take advantage of a wealth of the investigators and working with those investigators, and network outside of the school as well with our interdisciplinary colleagues. So, Moroni, I'll hand it off to you now for the remainder.
Thank you, Dr. Brody. Hi, everyone. My name is Moroni Fernandez. I'm a third-year PhD student. I'm currently working on my dissertation proposal, but broadly, my research interests are to promote equitable healthcare access and reduce dementia disparities. And I specifically focus on the Latino and Hispanic population. So this year, I am the student rep for the Adult and Aging Research Collaborative. And I just wanted to talk a little bit more about the areas of faculty research. So here at NYU Meyers, the faculty are leaders in the field of geriatrics and gerontological research. And I just wanted to talk about some of the following areas that our faculty are doing research in. So one of them happens to be Alzheimer's disease and other related dementias, where research is being conducted to improve the quality of care, support informal caregivers, and promote dementia-friendly communities. Another focus is community-based care. Across settings, our faculty is conducting research in long-term care, adult day services, home care, and primary care. Health equity, improving health outcomes, and reducing health disparities. We also have a global focus, looking to serve underserved communities on a global scale. And serious illness, performing observational and interventional research for seriously ill and older adults receiving care across settings. One of the great aspects of having faculty in all these different categories is that being like when I first started my PhD program, I was fairly interested in a multitude of different research aspects. And it was really nice to be able to work with a faculty member and be introduced to something that was fairly new to me. And just having those options is a really great, being a new researcher was very welcoming and a great opportunity, and currently still serves me very well as a student. Here are some of the AARC faculty members. So Myers is particularly committed to recruiting diverse faculty from various backgrounds and cultures, which really allows for a unique perspective that enhances research initiatives and clinical practices. So Myers faculty performs research with one another and across different research institutions and community-based organizations here in the US, which really provides students and faculty to engage in impactful work. I wanted to just highlight, so we have here Dr. Tina Satarangani. She is my advisor. I've been working with her for the past 3 years. Dr. Brody, who you just met. Dr. Dina Shulman Green, she's the PhD program director this year, and Dr. Jasmine Travers right here. And then I just wanted to highlight some of the current PhD students. So we have students from the first year all the way to 5th year, and having such supportive faculty really helps provide valuable guidance and having these faculty helps to navigate research challenges. And while providing the support, faculty also help promote independence for students, and they really help you prepare for future research endeavors. So for example, in my first year, I was able to co-author and be a first author on a manuscript working alongside my advisor. So being a student that was like fairly new to research, the faculty are really well connected to research funding, mentorships, workshops, and academic networks that will ultimately enhance your research experience. Thank you. And if you have any questions, me and Dr. Brody will answer them at the end of the session.
Thank you, Dr. Brody and Moroni, for that great overview. Then now I'm going to turn it over to the PHRC faculty and the respective student. Go right ahead.
Hi there, everyone. I'm Dr. Nicole Perez. I'm an assistant professor here at Myers, and my clinical background is as a psych mental health nurse practitioner. Thank you, Murray, for putting our slides up. Murray is our PhD student representative. My focus really is on clarifying biological and social underpinnings of depression and its varied phenotypes. I look at women, minoritized populations, and individuals living with chronic conditions. And so I just want to talk with you all about my experience with the Precision Health Research Collab. I'm going to hand it over to Murray after. I'm just going to kind of do a similar thing to what Dr. Brody did and give the overview of what our mission is and our purpose and some of the structure of what the PHRC provides. So if you could go to the next slide, that'd be great. Okay, so I think it's good to start with really defining what precision health is, so we're on the same page. When we talk about this, we're thinking about a highly personalized approach to healthcare and health promotion, disease prevention. And we're looking at accounting for variability, not just in genes and behaviors that we might think of as like lifestyle, things like diet, exercise, but also the social environment in which those behaviors are contextualized. So this is where we bring in things like the social determinants of health. Okay, go to the next one. Great, thank you. And so our mission really focuses on facilitating intra and interdisciplinary collaborations, thinking about research and scholarly activities related to precision health. We have interest in focusing on prevention and management of chronic diseases, and these are across the lifespan. So I'll just take a moment to note here that this group isn't particularly focused on one single population. We really do look across lifespan, across populations. And with that, we're interested in addressing gaps in knowledge with a focus on patient-centered outcomes. Part of what we like to do for each other is, being able to bounce off ideas in terms of grants and study proposals. We're a small but mighty group. I would say we're between 10 to 15 people. And it's really a nice space when, especially our ideas are early, we can get early feedback as we're forming those. And so our group, like the others, is comprised of faculty members such as myself, PhD students, we have postdoctoral fellows, and we have two biostatisticians that regularly attend. It's wonderful to have them there. And I'll just note that I have been a part of this group as in three different roles. I actually started with the PHRC as a PhD student. I stayed on at NYU for my postdoctoral fellowship and then now as a faculty member. And it's really been a very, it has just been such an important part of my trajectory, having that through line to be able to discuss my ideas, get feedback, and really be connected to this group with shared interests and also with different ideas as well to help expand what the kind of things that we're all thinking about. Okay. You can go to the next one. Oh, great. Thanks so much. So some of what we do, we have several researchers that are interested in like chronic conditions such as diabetes, cardiovascular disease, also folks that are looking at cancer survivorship, mental health, such as myself, and then populations living with HIV as well. But our approaches are still in the precision health realm, but again, that's pretty broad. So you heard me talk about genetics, genomics, but it is even more broad than that to what we call the omics umbrella. So this would include things like the epigenome as well, the microbiome, We think about things like digital health as well, and symptom management. So some of our faculty researchers are using things like actigraphy data. So they're kind of similar to Fitbits that would collect data on sleep and activity during the day. I know some faculty are using continuous glucose monitoring because we're really looking at that like personalized data so that our approaches and the interventions can be tailored to the specific individual. And then finally, at the foundation, we think a lot about health equity, and you can see those purple bubbles down there. There's a big research focus on health disparities. We focus on minoritized populations and thinking about these social determinants of health and really how they get under the skin and perpetuate a lot of these health disparities that we see. And so that's the high level. I'm going to turn it over to Mireille now to focus on some examples of some of the work our group has done.
Thank you, Nicole, for presenting what the PHRC is about. I'm just going to go in depth and share some concrete examples on some of the work that faculty does at the PHRC. And we're, as Nicole mentioned, we have around 10 to 12 roughly faculty members. And due to like the time limitations, I'm going to be able to highlight and showcase 4 of our faculty's work. And I'm going to start by Nicole. She shared her program of research, but I'm just going to add more details on her current study that focuses on reducing disparities in mental health among women with HIV. And for that, she's applying intersectional and multi-omics approaches to understand how experiences of poverty influence biological maladaptation and thus mental health outcomes. And we have Dr. John Merriman, whose interests align with how stress management interventions, particularly looking at mindfulness-based stress reductions, can improve cognitive function in postmenopausal breast cancer survivors taking aromatase inhibitors therapy. And we have Dr. Turley, whose research focuses on developing and testing culturally relevant behavior models for type 2 diabetes and working with special populations such as Haitian American immigrants. And Dr. Liu's research focuses on examining the effect of behavioral health on certain cardiovascular outcomes, also working with minority population. And this is just to give an example of how the diverse research areas are, and that you have a lot of opportunities to find among our faculty those who could match your interests and how you can grow as a researcher and as a nurse scientist in your pre and post PhD journey. And also showcasing the work of our postdoctoral fellows. We currently have one, Dr. Shiwan Huang, whose research interests intersect with chronic disease prevention, particularly looking at diabetes and cardiovascular disease, maternal health and minority and immigrant health. And if you feel that your research interests align with these domains, there's always room for collaboration, working on potential poster presentations, publications, and so many other opportunities. And of course, we have the support of biostatisticians, and you can get that support as PhD student as well as faculty. And currently, we have Jackie and Jinu attending our PHRC meetings, and they provide a lot of educational resources, support, and potentially going through peer review activities for journals, going through proposal planning, conceptualizing some study ideas. So they're very helpful. Jackie has some expertise in causal inference, clinical trials, and multi-level modeling. And Jinu focuses on study designs, provide insights on that, data cleaning and analysis, and as well as statistical modeling. And of course, the greatest part is that PhD students take part in the PHRC. So I just started the presentation because I have this section here where I'm gonna introduce a bit of myself. I'm currently in my 3rd year, and we have 2 PhD students in their 3rd year, and we have 4 PhD students in their 1st year joining the PHRC collaborative recently. And at this stage of my PhD journey, I have my dissertation study conceptualized, and I also took the opportunity because I started with some broad research interest, and I was able to hone things down and conceptualize what my interest is and come up with a realistic and feasible study that I'm going to soon start with data collection, hopefully after IRB approval. So my background is a cardiology clinical nurse specialist. I work at the CCU for for 5 years, and I'm still working as a per diem nurse in the acute cardiac care unit at NYU Langone. And my broad program of research concerns optimizing advanced heart failure care and coordination. And for that, I'm doing a dissertation study incorporating a mixed method approach to understand left ventricular assist device, which is an advanced treatment modality for heart failure, and focus on self and family management with the patients and their caregivers and how they manage their daily life with such a complex treatment option. But also along my side as third years, we have Samar. And Samar is also currently working on her dissertation research, and she's aiming to develop a sex education program for HIV prevention among adolescent girls and young women in Saudi Arabia using a qualitative methodology. And with us, we have the first year students. I'm just going to highlight 2 of our students who joined us. We have Jen, whose interests include incorporating behavioral and implementation science to enhance cardiovascular health among marginalized population. And at this stage, you could see when you enter the program, maybe you're starting with some just broad interest. Maybe you have clear layout, conceptual, or plan for a study of some sort. We have also Ranjani, who's interested in understanding the impact of the training of advanced practice nurses on community-specific disparities and certain health outcomes. So you can start with an idea, you can start with broad interest, or you can start with a clearly flushed out research question. And all through that, the research collaborative serves to provide additional resources for certain methodologies, opportunities for research, training, and also publications and so on. So it's a great place to flush out ideas, to learn from each other, to maybe collaborate, which is great. And with that, my presentation comes to an end. If you have any questions, I'm just adding our contact details. If you have something pops up along your journey as you plan for your PhD studies. And we are happy to answer questions at the end of all our collaborative presentations. Joseph, passing the button.
Thank you for that great overview. I appreciate it. And last but not least, I'm going to introduce Dr. Allison Skyers and Kim Hudson for the overview of the HSR-RP research collaborative.
Thanks, Joe. Hello again, everyone. So the Health Services Research Collaborative was actually the first research collaborative that was started at NYU Meyers. And it kind of came about because there were a lot of us who were health services researchers, and we were like, we really need to collaborate and find a way to get together and make some time to meet and brainstorm and, also provide support to our doctoral students. So, the Health Services Research Collaborative can cover a lot of areas, and there are many faculty that actually overlap between our research collaborative and other ones. Dr. Niles participated in our collaborative when she was a student in our program, and as well as several other faculty. So, my own program of research has 2 prongs. I work internationally and look at global health services research. Basically, how do we get the right nurse to the right place, right time, right resources. And domestically, I look at improving immigrant health, the point of care, with a specific care delivery issue around addressing language barriers at the point of care, and how do we make that easier for nurses? Because as all of you who are working clinically know, it is not an easy task. And so, but we have a diverse range of interests with our faculty members. One of our faculty members does home health care. Another faculty member leads our occupational health training grant, which is an incredible opportunity for looking at how does work affect your health. And we have a number of students who are using that to look at the nurses' work environment, study burnout in novel ways. And with that brief introduction, I'm going to pass it over to Kim, who's going to share a little bit more.
Sure. Hi, I'm Kim Hudson. I'm a second year BSN to PhD student. Give me a moment to share my slides. I'm still narrowing down my my area of research, but I'm interested in older adults with serious mental illness, and I like looking at it from like a systems perspective. I think probably you've seen quite a bit here there's a lot of overlap in these collaboratives. I also attend the AARC, and I get a lot of good stuff out of that. Like aging policy is like so particular, so it's like very nice to have somewhere to hear what's going on, the latest. But I also really like the Health Services Research Collaborative because it's more broad. I get to see other people's projects. I get to look at problems in different ways. Yeah, welcome. We focus on all aspects of health service delivery, the workforce, and the impact of structural factors on health outcomes. I know I wasn't familiar with health services research as a term before I started the program, but it's like definitively the space I wanted to be in. I just didn't have the words for it. So a definition is that it's a multidisciplinary field of inquiry, both basic and applied, that examines access to and the use, cost, quality, delivery, organization, financing, and outcomes of healthcare services to produce new knowledge about the structure, processes, and effects of health services for individuals and populations. So obviously pretty broad. Some of the faculty, and I'm definitely missing people, and I hope I don't offend anybody, that participate in our collaborative, though it's a little more student focused, which is kind of fun too. Dr. Squires, who you met, Dr. Simple, who she's the occupational one, right? Jump in for me, Dr. Squires, if I'm not representing people appropriately.
Yes, Dr. Simple leads. Yes, she leads the T42.
And Dr. Ma does this like excellent work with home health. I like was just like playing around with what does like using Medicare and Medicaid data look like, and I had no idea, and just like a 30-minute conversation with her like put me on the right path. Some of our recent graduates, actually, Veronica pointed out, but they were presenting their dissertations in the HSRC. Dr. Eakley, who the mental health nurse practitioner who investigated how mental health practitioners take care of pregnant patients, and Dr. Gerchow and her work with teen moms. And it was just like really neat to like see them develop over, like I've only been in the program for a year, but I saw them working on their dissertations, and then I saw their like the final defense, and it was very exciting. So yeah, what we do in our collaborative, it's relatively informal, but you can get feedback on like posters you're doing, presentations, grants you're interested in, just talk about ideas in general, get to learn from people with this really broad body of knowledge. And also, has been very helpful for me as a student seeing, like, now I'm in my second year in the program. So like, I wasn't sharing very much my first year, but it was nice seeing, oh, okay, this is what year 2 looks like. This is what your candidacy looks like. This is what your dissertation looks like, seeing people at different stages in the program. And it's a lunch and learn. You get to hang out with a nice group of people. That's all I have.
Thanks, Kim. And we're very much about creating safe mentoring spaces, because it's part of your learning experience is learning how to collaborate with your peers, learn from each other, but also be vulnerable, because you're learning how to be chronically rejected as part of being a PhD, right? You're getting articles rejected, you're getting your grants rejected, you're getting conference abstracts rejected, but you're also getting them accepted. So it really is about creating a supportive community where you celebrate each other's wins, and you also you mourn or go have beverages of choice when you get yet another rejection of some sort. But it's this whole idea of this is our way of creating community, and we really encourage what I would call a non-compete environment. Some places are very much, oh, you have to compete for all these resources. It's like, no, you're all in different areas. You're all going to have different resources, opportunities. Cancer is really well funded. Health services research is not so really well funded. So, you just have to kind of balance out these things. So it's really about celebrate each other, create a supportive community, and, these are going to be your colleagues in the future. And hopefully hopefully our graduates are taking that with them wherever they're going.
Well, thank you for all the faculty and students here that provided the great overviews of our research collaborative. So I'm opening the floor to the students that are here, prospective applicants that are here. If you have any questions, feel free to unmute yourselves and utilize the opportunity to introduce yourselves and ask any questions that you may have.
Hi, I will be an international applicant from Japan for the fall 2025 PhD program. And thank you very much for the presentation about the research collaborative. I was very interested in the learning more about the collaborative, so it was very informative. I have two questions, a very broad question. But one is like Kim just mentioned, it seems like some of the research collectives, they overlap in some aspects. And I was wondering if each student choose one research collaborative or two, like Kim just said, in their first year, they enter the PhD program. That's my first question.
So there is no one pathway, I think is the best way to put it. Because we are purposefully small and have a very tight-knit community, each student has the opportunity to build what is going to be the best pathway for them. So you heard that Kim attends both the Aging and the Health Services Research Collaborative as an example. Some may choose to just have one as their home, though students tend to work across, there are cross-cutting kind of themes across all of our research, including health equity and digital health, for instance. And so there are opportunities regardless to work across, no matter if you select one or two as kind of central homes for where you would be.
Thank you very much. So you will be able to kind of figure things out once you're admitted to the program.
Yeah.
Yep.
And so students have a primary advisor they work with who is at the time of admission closest match to what their area of study is. Sometimes that does change over the years as you more hone in on your work. And then that advisor, faculty advisor, helps you to hone in on your direction, on your goals, on how you want to develop as a nurse scientist. And so it all comes as part of that is, okay, I'm working in this area, but it seems like there's some overlap over here. Well, you should maybe attend both and learn a little bit about both, or no, this really, I fit here and this is where I belong. And so it's about creating belonging in community and space, and that's going to be different for each student.
Because we know you're going to change your mind. It's okay. Happens to everybody.
Okay.
And if I
Thank
can
you.
add something, sorry. And if I can add something, because in all collaboratives we get to have guests and experts from outside of NYU, even from within NYU, outside of Myers, and sometimes we do disseminate these. When a guest is coming to give a talk on a certain methodology on a certain topic. So even if you're not attending a specific collaborative, but there's a talk that have a certain communication sent about it, you can attend and learn more, and you can even ask to receive such communication.
That sounds very exciting. Thank you very much. My second question was, so it sounds like the main difference of being in a research collaborative and being in like a meeting within your own department is that you can collaborate with other departments.
Yes. The research collaboratives give us a really flexible way to operate without dealing with a lot of bureaucratic infrastructure that would come with being in a formal department.
Okay, thank you very much.
NYU Meyers does not have departments. We are a faculty of the whole. So we have program work groups, but our faculty collaborate all together. So our PhD program doesn't sit within a given department. Our PhD program is all of the faculty, made up of all of the faculty and students that are teaching and or taking classes enrolled in that program. There's no, you're in department X or Y, and therefore this is where you work and this is what you do. It's much more flexible than that.
Absolutely.
Thank you very much.
And I'm sorry, I'll just add, it is flexible, and that allows us really to connect students and each other with collaborators that are even outside of our college. We even have a member who was a recent grad, well, not someone recent anymore, a graduate, Mila, who has now moved on. She is a faculty elsewhere, and she will still attend from time to time. So people are always welcome to join, and it does allow for that flexibility even beyond our walls, so we can keep collaborating.
Thank you very much. I now understand more about the system, the program. Thank you very much.
No, great questions, Meg. Thank you. Does anyone else have any questions? Feel free to take the opportunity.
Yeah, I'll jump in here real quick. My name's Maren Beeling, and I'm tuning in today from Salt Lake City, Utah. I'm very excited to be here. And I wanted to say thank you to everyone for the presentation. I really love how you have the collaboratives, and that interaction seems great in between all the different groups. But my question kind of concerns the logistics of the program, and I've read a little bit about it on the website, but just in terms of virtual versus in-person, length, what do the different years look like, didactic versus independent dissertation work? I would love to hear from either students or professors about just kind of the format of the program.
Well, I'll
Allison,
just,
would you like to jump in?
sure. I used to be the program director, so I can do this spiel really, really quickly. So your first 2 years are coursework. And the idea is that by the end of your second year, you're working on developing your dissertation proposal. We are an in-person program, and but we do come with a full tuition scholarship and funding, and we don't tell you not to work. Most of our students do find a way to work per diem because it's New York City, and doctoral stipends are still what they are. But we have a great network that if you're licensed, we can help you get a job. And international students, if you actually if you take NCLEX at some point, you can work on campus at the NYU health system, which is considered on-campus employment, which doesn't violate your visa requirements. So that makes it a little bit nicer for international students as well. And then after your second year, you can pretty much, you have a lot of flexibility in terms of where you are in the world. Samar is a good example. I'm the chair of her dissertation because of the global health angle that comes with her work. And she's currently back doing her dissertation fieldwork in Saudi Arabia, in Jeddah. And so that's really, for her, that's ideal for her family situation and a variety of other factors. So we really want to encourage people that want to do, if you think you're going to if you want to go away for your PhD, but then go back to where you are, we want to encourage you to do research in a place where you think you might want to land. And if you're international and you want to do research back in your home country, we totally can support that as well. And we're a faculty that's global. We are used to dealing with wonky time zones and lots of crazy differences like that. Like Meg, kudos to you for being on, though it's not a bad hour of the morning for you in Japan right at the moment. I'm not sure where other two folks are coming from, but always appreciative of people that take the time to come to these info sessions. But the idea is we can work with you, and that funding holds whether or not you're in person or whether you're back home or placed where you're doing your dissertation work. So you have that cushion at the very least, but it's really, really important that you're not working full-time when you're in the program, because you will never get done. And that is really what we see is it's really difficult for people to finish if they are working full-time. And because of that, though, most of our people get out within 4 years, which is great. And that's been pretty consistent. It's 4.5 years.
Yeah. There are slight differences if you're if you're doing BSN to PhD or MS to PhD, because you have a few extra coursework requirements, but generally 4 to 4.5 years. And then the other kind of piece that goes along with that is we actually have a 7-year maximum. We don't expect people to hit that, but we have that there really as a stop. Like, if you're not close at this point, this is a problem for everyone, and let's figure out. So we really do try and move students along. On the other hand, we are not a 3-year program. And we don't believe that is the best way to become a nurse scientist. And so it is not part of what we do. And we think that's a strength of us because we want our students to be immersed in the research world and the work that they are doing. And part of that work also includes uh, over 1,000 hours that you are working on research within residency. So it's really takes some of the good things that come from the basic sciences and engineering and brings that in to really ensure that you have that experiential learning as a core piece of what is an educational expectation here. Which also means you get to work with lots of students and lots of faculty on different projects and see different ways that different things are done as well. That helps you figure out your thing, so to speak.
Yeah. So for example, like you may want to gain some experience doing clinical trials. I don't do clinical trials. Ab does clinical trials. So you can go work with Ab on clinical trials, and you can come work with me if you want to do other things around qualitative research or survey research or, in some ways, big data sets research.
And I'll just add, like dovetailing on what Dr. Brody and Dr. Squires said, that, it's not a 3-year program. And that also means that there's not you can do secondary data analysis if that's what fits your research question, and that's there, but that's not necessary. We want the approach to follow the research question. So we have many students that collect their own data, and we do, have processes and systems in place to support that. So it is really about what your research question is, finding out what you're interested in and passionate about, and providing the support that you need to get you through the program. And I also wanted to add that if it hasn't been, I'm sure it's been announced, but there is another session on PhD life that I don't think has occurred yet, if I'm correct, that you'll be able to get the student perspective on what the trajectory through the program is like.
And if I can
That
add
session
really
will occur
quickly.
on November 11th.
Sorry.
Go ahead, Rory, sorry.
Oh, sorry, didn't mean to cut you off. Mary, I was born and raised in Salt Lake City. So if you have any questions about like the logistics of like possibly moving here to New York City, or if you want to like hear about my timeline and my plans after, I'm happy to share.
Okay, I love that because I have a specific question for you, so I can reach out individually then.
I was
Thank
going to
you.
ask if you two knew each other because, Utah's a small place, so you never know.
The whole state is a small town here. Thank you, Moroni.
Joe, you're on mute.
Thank you. Does anyone else have any questions? I encourage you to just go ahead and unmute yourselves and start a conversation. Our faculty and students are here for you, and I encourage you to take advantage of the opportunity.
Hello, everyone. I'm BC, an international student looking to join in fall 2025. I just quickly wanted to ask about the factors that could make me a competitive applicant. I wanted to know if it is acceptable or if it is advisable to reach faculty members that would probably make could be a good mentor during my program, or I look forward to working with. And also, I wanted to ask about the aspect of publications. As an international student, I only have my first publication under peer review. It's not out yet. I don't know if this is going to be any problem or if I'm still welcome to apply.
So there's a couple of things. It is important. Our application is very clearly spelled out as to what we are looking for. Those things really fit around a goal of becoming a nurse scientist and working in that area, on having a match with a faculty mentor or mentors, potential mentors within the College of Nursing. And there's a couple of other prompts in there, but a lot of it is around really showing why this program is a good fit for what you want to do in your career, and that it matches well with the program. So that's the number one thing we do look at. We certainly do look at different outputs of what could be considered productivity like papers, but it is taken within a holistic perspective of the application. So it's one element. We've had students that have come in never having published a paper, and we've had students who have come in with many, many times that. And so it very much varies based on the fit, how you write your essay, and then how that works within kind of the um, addressing the goals of the program and your goals and making sure they match as part of your application. And so I think those are the key things. We do encourage students to reach out to potential students to reach out to individuals who they feel would be a fit, as well as to our program director, Dr. Shulman Green, who's not here this evening, if you have questions about whether there might be a good fit within of advising. And the way that fit probably isn't the right word, but that you're in alignment with the person who would be your advising. You don't want someone who um, isn't in the area of research that you're in. It doesn't have to be down to the minute level, but if they're not in that area of research, that's also not in your best interest. And so we try and make sure that there's a pairing between who your prospective advisor would be and the student's area of research interest. And we know that the area can change a little bit, but I'll give an example. In the past, we had a number of students who did pediatric research. We have one clinical faculty member who is a amazing faculty member, has done a lot of work in pediatric policy. That's one faculty member within our entire college. And so unless there's another aspect of it where it fits within the aspect of another faculty member that's doing similar methods or similar project, but in a different population, that's not going to be in your best interest, as an example. So we do try and make sure there's alignment because we want all of our students to have the best possible experience here at NYU. So I think those are the things we look for the most when we go through the admissions process.
Yeah, and Samara is another good example. She's looking at developing a sex ed program for young women in Saudi Arabia. Obviously, this is not my area of research, but because I've done a lot of global health work and I understand how services and systems are structured in different contexts, then this way we're able to work together and think about, how do we place this problem in global context, but also then translate it into a local solution. So, we're not a, 100% interest match, but we are a good match in terms of thinking, in terms of the situation of where her study is taking place and, sort of that bigger health systems picture of it. But she has other members on her committee who have expertise in HIV prevention and also in adolescent health. So, your committee ends up rounding out your areas of expertise, and it's a great way to work.
And I think that's one of the benefits of attending the research collabs is because one person, oh, I'm so sorry.
Yes, you can go on.
Oh, okay. I'm sorry. Is that you're not going to get everything you need from one person, right? So we're really invested in helping you find the right team. So we'll have folks that are on your team that are more content expertise and method expertise, and you're not going to know everyone when you first start in the program. And so that attending the research collabs, maybe one or two, helps you get to know the faculty and their areas of expertise, so that we can build that together for you.
Thank you very much. I have a better understanding of the entire concept now, and I really, really appreciate you taking your time to explain.
We have a couple more minutes. I just want to see if there are any other questions from our prospective students this evening. Okay, so Joseph, if you want to take us on home by sharing the next set of
Yes.
info sessions that are available, and then please do reach out to Dr. Dina Schulman Green or any of potential faculty if you're seeking to move forward. It is better to have a conversation before applying than to wait for and hope for a interview and then meet faculty for the first time.
Thank you, Dr. Brody. So we do have 2 more PhD info sessions coming up. The next one is going to be on Monday, October 21st, and that will be members of the PhD admissions committee. You'll be able to speak with them, and they'll just be talking about the application and process and what they look for. And you'll be able to, the next info session will be on November 11th on Veterans Day at 3 p.m. and it will be life as an NYU Meyers PhD student. You can pick the brain of our current PhD candidates and ask what they think about NYU Meyers. So I highly encourage you to just register for those sessions on our website. And for those of you around the area, we are actually hosting a doctoral fair on November 7th. So I encourage you to just check our website and register. It's in person. You can meet our PhD program director and also hear more about the DNP program if you're interested. Let me know if you have any questions. I'll put my email in the chat. And thank you all for joining us today. I really appreciate your interest in NYU Meyers and our program. Take care and have a great day, everyone. Great night.
Thank you so much. Take care.
Take care.
Bye all.